At Montana State University, our Global Learning for Health Equity project focused on the sexual and reproductive health of adolescents. We began our project in the explore phase of global learning. Our goal was to explore global ideas and knowledge from health promoters in Kenya to innovate new ideas for adolescent sexual and reproductive health equity in rural and tribal areas of Montana. We situated our learning at the policy, healthcare, community, family, and individual levels. Our Montana project team included Doctors Molly Secor and Beth Rink from Montana State University, Olivia Johnson from Fort Peck Community College, and Nona Main from Montana Family Planning. This group already worked collaboratively on the Fort Peck Indian Reservation in northeast Montana using community-engaged approaches to promote adolescent sexual and reproductive health. In February of 2024, this Montana team traveled to Kenya for global learning. To learn about adolescents' experiences with sexual and reproductive health, we held listening sessions with adolescents from rural and remote areas. First, we visited with adolescent mothers in the Maasai region of southwestern Kenya. Here we learned that adolescent mothers struggled to return to school after childbirth. They emphasized the importance of schools supporting return to school through counseling, workshops for teachers, and facilitating education for their parents. As one young woman said, "Teen mothers are special and they need to be taken care of even if they had done a mistake." We also visited young men and women at Kamuchia Secondary School in rural Kenya. These students emphasized the importance of learning about sexual health, access to adolescent-friendly health services, and having teachers and other adults who they can trust and support them. Our travel in Kenya also included meetings with organizations that provide services for adolescents in rural Kenya to promote health and well-being. These organizations provided examples of how the adolescent health policies in Kenya were implemented at the community level. For example, the Tharaka Women's Welfare Project provided alternative rites of passage ceremonies for women to deter female genital mutilation as required by Kenyan law. In January of 2025, our Kenya team partners visited Montana. Our Kenya team included Drs. Albanus Mutisia from the College of Nursing at Jomo Kenyatta University, Dr. Miriam Wagoro from the University of Nairobi School of Nursing, Dr. Daniel Musaya, Research Director at St. Paul's University, and Joan Rima, Nursing Services Director of Chogoria Hospital. Their visit included time in Bozeman at Montana State University and travel across the state to the Fort Peck Indian Reservation. Our Kenya team visited the Mark and Robin Jones College of Nursing to learn about simulation and case-based education for nursing students, including adolescent sexual and reproductive health training. At Fort Peck, we visited with school administrators and students at Brockton Public Schools to learn about how the tribal education system provides sexual and reproductive health education and services. Our visit also included presenting our project to the Fort Peck Tribal Council and discussing shared challenges and solutions for adolescent health in rural Kenya and Montana. Our visit to Fort Peck provided an opportunity for our partners from Kenya to learn about Indigenous culture, share tribal customs, and experience snow and temperatures below zero. Our lessons learned included 1, effective solutions to improving sexual and reproductive health equity require policy, community, family, and individual level interventions. 2, there are shared cultural beliefs and practices between traditional Kenyan tribal culture and Indigenous culture in Montana that inform sexual and reproductive health for adolescents. And 3, providing sexual and reproductive health education and services that reflect the blending of tradition and science are more acceptable and easily adoptable. In the next phase of our work together, our team plans to move toward the adapt phase of global learning. Together, we will disseminate our lessons learned for practice and policy, present our findings to the Kenyan Ministry of Health and policymakers, collaborate with Fort Peck Tribal Health to improve their adolescent-friendly health services, and identify opportunities for adapting current approaches to adolescent health in Montana and Kenya based on global learning. We are grateful for this rich collaborative and innovative opportunity for global learning.